there's a reason why I actually put this webinar out. The reason is because a lot of people, as being a diabetic or being a pre-diabetic, even especially pre-diabetic, are not really much understand why your foot is so important to take care of. I personally have a very sad experience with some of my patients when I was working for the Hawaii hospital, whereby a patient comes in who is an elderly Japanese lady. She liked to do yard work, and a little twig, small little twig, which injured her foot, actually in a toe area. And she was so kind, but unfortunately, because that, her toe area doesn't get well anymore. Eventually, we have to cut off all her toes. But as time goes on, that still cannot continue to heal. And so we have to cut off her foot. And eventually cut all the way almost up to the knee. And she naturally had no longer able to do any yard work. And this is not the first experience I have, but there's multiple experience. So I thought that, wow, if she can able to protect herself, like, for example, wearing a, shoes or something like that, then she can be a much more better individual and can able to do that. So as I mentioned earlier, we have a, at the end of the day, when you are not taking care of your leg or your foot or even of your hand, if you are diabetes, you really can be potentially in a really sad situation, can able to give you very permanent damage, like cut off your foot and so forth. Now, pre-diabetic, a lot of people thought that, well, pre-diabetic, I should have no problem. But I found a lot of people at pre-diabetic also start seeing the situation come on. First is they start finding the skin become very dry, the leg become very dry. So if the leg become very dry, what happened is eventually they're going to have a little bit here and there, a little bit scar, scratch, and it doesn't heal that well. Now, then you are in a moving stage that if you become a diabetic, that can be potentially become a very serious event, because if it doesn't heal and become gangrene and so forth, so forth. So you really have to take care of that. Another thing too is a lot of people don't realize all this can be prevented, because when I look at my older patient in Hawaii, if she wear shoes, for example, while working yard work, instead of just doing with her little Japanese slippers, and a little twig get poked into her toe. If this is wearing a shoes, she have no problem. She will prevent this entire occurrence. So imagine that we could actually protect ourselves. So it's just a matter of you able to do it or not, or able to really have some smart idea. So ensure that you will not be, injure yourself in a wound that you cannot be healed. So anyway, that's the reason why I thought this lecture will be really helpful to get everybody. I give you a story, and so you can able to have a much better understanding what is your, what we can really to able to protect yourself, prevent really serious sickness. Okay. Anyway, can Edwina or Gordon give me a 1 if you can see me on the Zoom meeting? That would be wonderful. You can do that. Okay, thank you very much. 各位堂友 ，Hello， 我係 Andrew 好高興今日咧又可以能夠聽喺呢度見到你哋啦。咁希望你哋可能夠即係知道點解如果一個糖尿患病者係需要一定要有呢個管理隻腳嘅問題咧。講一個真實個案俾你聽。我以前咧做 ICU nurse 照你所知啦。咁我喺美國做 ICU nurse。咁有日本病人咧，佢就去個花醫嗰度做 yard work。咁但係可惜咧，就佢花醫嗰度做 yard work 咧，佢唔覺意有支即係刺 好大支啫喎，啲咁大嘅喎，刺入去個腳趾嗰度。咁但係好可惜，個腳趾刺咗之後咧，咁就啲嗰度開始爛泡啊。咁eventually個腳趾又所以切晒啦，然後之後就該腳唔好啦，就切埋隻腳啦，因為切到差唔多去到膝頭哥嗰度。咁就係一個好苦，即係又好受苦嘅情況啦。咁我希望即係我哋嘅所有朋友喺呢度咧，都唔會係 end up 做咗呢樣嘢。其實全部係可以防禦到嘅，就係佢只係話着對鞋，咁佢嗰個刺就唔會刺到自己啦，係咪？好簡單。所以變咗嚟講咧，就我今日咧個 lecture 咧，都希望咧做到呢樣嘢咧，就幫咗大家更加了解點解原來咧係有呢樣嘢係咁重要嘅，即係要點樣防禦嘅咁重要。So today I'm going to start the lecture now. And thank you very much. I have a lot of people from all over the world, from United States. I saw quite a few people from US, from Hong Kong, from Southeast Asia. So it will be very good. We get able to join our lecture. So I think everybody can see the slide now. So I will start from here. Okay, good. Okay, today our lecture will be the proper method daily diabetic foot exam. And basically it's really a step-by-step guide. Now, you might say, hey, I don't have any issues. Why should I have to check my foot right now? But you know what happened is, actually this is in a way, if you think about deeply, this is a habit forming if you have diabetes. You got to start checking your feet all along as a habit. Because you have to habit check whether your foot is, daily have any kind of issue, and I will show you the step-by-step checking your foot. So you got to have this information with you, so you form the habit, so later on when you get maybe 10 years from now, you really become a worse diabetic, for example, at least you have the habit you already established, so you don't get that issue. So that's why it's so important. Even you are pre-diabetic now, you need to start checking your foot, checking your skin. So you need to start that habit of putting cream on your foot. So this is the way I thought perhaps if I give you some guidance, you can understand and you can follow through. So by the time you get older, this established habit is already there. So you will not make it hard to establish a habit. Excuse me. OK， 各位堂友，其實點解今日咧要講呢個講座咧？就希望你哋咧能夠有做到一個叫做習慣啊，每日有個習慣去 check 你嘅腳。因為糖尿病病者咧，如果你係每日可以 check 到個腳咧，最單度咧你冇咗呢個。So basically, you really want to establish this habit, so you will continue to work on throughout your life, basically. 所以今日咧，我呢個節目咧係希望大家可以start 到個習慣啦。咁能夠每日咧你都能夠 check 你隻腳，咁以後咧就當你係到20年後或者10年後咧，你都係 check 緊你隻腳咧，變咗你唔會有呢啲咁嘅後患症嘅問題。Okay, so today we're going to talk about why would daily foot exam important, what is a step-by-step guide, identify the potential complication, and how to best practice to look at your foot, and how can Lowsutea help, and then we'll save some time for question and answer. So 今日我介紹咧就第一介紹咗點解每日要睇下隻腳咧，點解咁重要咧，同埋點去睇咧同埋仲有咧就如果唔做有咩嘅併發症咧，同埋點去管理你嘅腳嘅健康咧，就同埋咧仲有咧就係點糖尿呢個 Lowsutea 話虛糖就係點幫助你咧，咁同埋就有時間俾你去問 question 嘅。So today we have a lot of people who actually came in. I don't recognize them with the names and area. So probably they're a new customer, a new enter to our lecture. So I thought perhaps I still going to take about 5 minutes very quickly to let people understand what is diabetes or pre-diabetic. So that way everybody can be easily understand these 4 stages. Now, actually, most of the doctor will talk about diabetes a little more complicated. I make it a 4 stages very simple. The first stage is your LDL cholesterol goes up. And they will damage the B cells, which the B cell take the sugar into the cells. If the B cell damaged, more B cell come out, it doesn't work. So the sugar and the cholesterol mix together, your blood becomes thick. That result, you move to stage 2, because that is the most worst thing of diabetes is the blood becomes thick. It will plug everywhere in your body, your brain, your lung, your heart, your kidney, and forming this plaque. So when you form this plaque, then your blood pressure goes up. That's the stage 2. Plaque and blood pressure goes up. Now, then you very quickly, you're not doing anything, you don't change your lifestyle, your blood sugar continually goes up, and then you will move to a pre-diabetic stage. How do you know a pre-diabetic? The doctor everywhere in the world, it's the same thing. They measure the hemoglobin, which is a red blood cell, measure the amount of sugar attached to this hemoglobin. So if you are 5.7 below, you are a normal person. If you're 5.7 to 6.4, you are a pre-diabetic. Now, all doctors will do that to measure you, to tell you, hey, you are pre-diabetic. It's too bad at this stage, you have no medication. So you basically, doctors say, hey, you're pre-diabetic, maybe you don't eat too much sweet. So people really do not know they don't eat sweet, but on the other hand, they still eat rice, they eat spaghetti, all kind of good stuff. So at the end of the day, nothing has changed. The lifestyle don't change. In 3 to 3 years, they will switch to a diabetic, will go to stage 4. Anybody move over A1C over 6.4, they are a diabetic. And once you can be diabetic, usually the doctor give you a little time to see you can able to reverse it. If you don't reverse it, you're over 7, doctor will start medication. And you're permanently diabetic. And that result, your insurance goes up, everything goes up, and then your health also will deteriorate. So basically, this is the 4th stage. And everybody got to remember this, okay? 各位朋友，每一個病人咧都有呢個4個 stage 咧，係去變咗糖尿病嘅。第一個 stage 咧就係 LDL 上升。如果 LDL 上升之後咧，就會損壞嗰啲 B cells。損壞咗 B cells 之後咧，嗰啲 B cell 就唔帶啲糖入去個細胞裏，因為 B cell 帶糖入細胞裏面啦。咁啲糖咧喺個血管度越整越高，然後加埋嗰啲膽固醇 LDL 咧，嗰啲血就變咁好結。咁呢個 stage 1咧就會好快就 move 咗你 stage 2，因為好結嘅時候咧，全身個血管咧就可以 form 啲咁嘅 plaque 板塊，就塞咗啲板塊咧，咁嘅血壓咧就會上升，因為嗰啲血管裏邊咧有好多板塊嘅頭啊、腎臟啊、心啊，全部喺度塞。呢個就係最大問題嘅糖尿病嘅出現啦。咁當你塞咗之後咧，咁佢就會血壓會上升啦。咁如果你繼續係咁嘅生活咧，咁 guess what？ 你會係個糖繼續上升，咁你就會去到第3個 stage， 去個前期患病。嗱，每一個醫生都 measure 佢前期患病，啲 measure 佢就 measure 你個你個血化紅蛋白一個 protein 叫做 hemoglobin， 呢個 protein 有幾多 percent 嘅糖黐咗喺個 protein 度。如果嗰度咧黐咗落去咧，你只係有5.7% 咧，咁你仍然都係叫做一個正常人。多過5.7咧，要到話要係一個唔係已經係一個前期患病，去6.4， 5.7到6.4前期患病。如果你 make it 做3年咧 ，guess what？ 你就轉咗個糖尿患病者啦。咁原來咧，你去到7咧，醫生一定俾佢食。當你做咗呢樣嘢嘅時候咧，你就永遠翻去後邊噶咯，即係永遠都係會變咗糖尿病人噶咯。Okay? So how Lowsutea works basically is very simple. Why we recommend Lowsutea can help you? Because Lowsutea has 2 things. One is called the guava leaves. What guava leaves is basically block the sugar entering the blood vessel. So you less sugar going to the blood vessel. Bitter melon, it has a very special things that will increase the insulin sensitivity. It take back the sugar into the cells. And then if excess sugar, they will dump the sugar, cholesterol, and also your salt from the urine, dump it out. And that result, your sugar, cholesterol, because salt went down, so your blood pressure go down. And plus it detox. So you basically, your 3 high will go down. In other words, your sugar, cholesterol, and your blood pressure will go down. So it's a very simple but very unique, very workable product, and it's very delicious. And that will help you really prevent your blood sugar going up and cholesterol going up. Now, besides that, we have also 5 programs to help you, because we don't want you to just drink the tea. That's why we have diet program to help you understand what diet, low carb, low fat. We'll also teach you how to exercise, do 10,000 steps a day. You have to weight control with a BMI under 23. Every week we have a doctor, nurse, or professional webinars like the one you have today. We'll also teach you how to track your blood, so you can able to track your blood, your weight, and the food you intake, and your carb intake. So that way you will always remember how to do that. So that result, you will be always in good shape to prevent your A1C can be dropped from 10% all the way down to 5%. And that's our goal. And this is what we do in our company. Is not only give you the tea to drink, but it's also give you all these supportive to give you, ensure holding your hand throughout your diabetic journey, to encourage you, to motivate you to continue to do that. Then you will not get into diabetic complication. 嗱，各位朋友，我諗你聽過啦，去糖茶點解會好咧？就因為我哋有個番石榴葉咧，係 block 啲糖入血管裏邊啦。苦瓜咧就係將嗰啲胰島素嘅敏感度上升啦，咁就帶翻啲糖入細胞裏邊啦。有多咗糖咧，佢喺尿啊，同埋膽固醇啊，同埋鹽啊，就喺尿啊掉出嚟啦。咁然後咧就當你做咗呢樣嘢嘅時候，個血壓都會降低，所以膽固醇、糖同埋血壓都會降低，同埋開始幫你排毒。咁其實我哋公司咧唔係直接叫你飲茶，我哋仲有一個好好嘅5個 program。第一就我哋你飲咗去糖茶之後咧，我都教你去點食翻好啲嘢，好似食低碳水嘅食物啊，低脂肪食物啊，同每日咧要有行1萬至8000步1萬嘅運動啊，體重要降低到 under BMI 23啊，同埋有醫生講座咧，每次都鼓勵你啊，同埋點樣度血糖咧。咁呢啲全部咧都係我哋公司咧係幫助你去鼓勵你嘅 ，OK？ 咁 anyway， 如果你唔做呢樣嘢咧，係有好大問題咧，就係你會 end up 咧就好多不同嘅併發症出現嘅。咁呢個我哋希望你就唔會啦。Okay, so now we'll talk about a proper method for daily diabetic food examining step-by-step guide, okay? So we're going to go over this to help you to better understand how you to check the food, okay? 今日咧我就開始咧講點樣能夠幫助你去 check 你隻腳係點樣係去檢查正確嘅方法 ，okay? Now, as you know, diabetic mellitus have millions of people, especially worldwide, 430 million to be exact. And there are 1.5 billion people are pre-diabetic. And this can be, if you don't establish your daily routine, this can potentially become a serious complication and you don't manage properly, okay? And food problems are common for many diabetes people, and they can lead to serious complications such as infection. And eventually, infection don't get well. You know what? You have to amputate your foot. And so you lost mobility function is detrimental to your health. So I hope this lecture will give you this information. You can able to take care of your foot. So unfortunately, foot management is one of the things that many diabetes people just forgot, okay? So I met a lot of people who have diabetes. The foot is swelled up with red spot. I said, wow, you don't take care of this, you're in big trouble. And so they really thought that, well, maybe I'm old. So that's usually the case. It is not the case. So imagine you gotta really make sure if you see your foot like that, you gotta take care. You have to go to see a doctor. Don't get the infection get worse. OK， 嗱，今日點解會講呢樣嘢？第一，因為原來全世界有438個 million 嘅人係有糖尿病啦。咁亦都知道咧，原來啲糖尿病有好多不同嘅併發症，腳係一個好大問題。如果你去即係整好隻腳，你個併發症係好嚴重，因為如果腳係發炎咧唔好咧，你要割咗隻腳，咁你就冇咗所有 mobility 行唔到啦，好痛啦，同埋咧就仲有咧就你係對整體嘅人生咧都有好大嘅改變。咁糖尿病咧管理喺隻腳嘅管理咧係好多人都疏忽咗嘅。咁今日我希望咧趁呢個機會講咗之後咧，你大家都會疏忽。嗱，呢個唔係就係糖尿病啊，仲有前期患病一樣。因為如果你唔係糖尿，但係前期患病咧，係咪咁重要啊？一樣咁重要，因為你要開始 establish 呢個習慣，要建立呢個習慣去 manage 隻腳。OK， 得。So why daily foot examination is so important? Okay, now people who have diabetes, one of the things that the risk of the foot get bad is very high. The reason is because remember the blood circulation down to the foot is always very poor for diabetes. And that result, they also damage many of the nerve. So when the nerves are damaged, you know what? You cannot feel. You have no idea how you feel that. So that result, you will be continue, cannot feel when you have injury, and you will not understand, wow, I have an injury there. I need to take care of it. So you basically ignore it because you can't feel. Okay. Now I already noticed. Matter of fact, I have quite a few individuals in the chat group ask me, "Oh, my leg get numb, or my foot get numb." Well, the reason of that is because of the fact that when you're diabetes or pre-diabetic, one of the early sign is your foot get numb, your leg get numb. So you need to continue to monitor that. Matter of fact, a lot of times you might even have to massage your foot, for example, to make sure you increase the circulation. That is something that you gotta do. So you gotta people cannot understand why my foot can get injury because you cannot feel. Well, because you have no pain, okay? Because the nerve was damaged, and then plus the poor circulation. And you need to also daily examine your foot because since you cannot feel the pain, so you need to look at it, see any injury, so you can identify, see whether you have any kind of injury which you need to take care of right away to prevent complication. Now, so foot examination is a really important part of your daily activity for self-managing diabetes, okay? So this is something that just to set you up the stage, why is foot examination important? Because you have to look at it every day. 嗱，點解每日去睇個腳咁重要咧？嗱，好簡單。第一，每日要睇個腳咁重要就係因為你個神經系統係俾一個當你糖尿病嘅時候咧，全身係咁塞噶嘛，個腳嘅血管亦都塞喎。咁佢已經都會係因為呢啲塞嘅血咧管咧，亦都損壞咗個神經系統，所以變咗好多人咧，我係糖尿病咧，我係個腳咧係感覺唔到嘅，唔會痛嘅。咁如果你有任何 injury 啊或者整親咧，你又唔覺得痛喎，咁你冇理佢，咁啊發炎，咁就上下就啲嘢唔好，你就割咗個腳，冇慘係咪？咁所以咧。你只能夠一樣嘢就每日去睇下佢係咪你嘅腳有任何問題，呢個係你每日嘅生活嘅重要一點咧，係幫助你去管理隻腳嘅。所以每日你都要睇，同埋咧，如果你嘅腳係開始冧咧，你開始要做好多 massage 啊 ，increase 佢 circulation 啊，呢啲係要做嘅。OK， so how do you do this check then if that's the case? Okay, very simple. The first you have to check is you remove the socks and then look at you have to basically, now, when you are, let's go back one step. When you are a diabetes, we always encourage you to wear socks. Reason is you always shoes, cover shoes and socks. There's a reason for that. If you have wearing comfort wear your shoes and socks, you have a high chances not to get injured. You have lower chance, not a high chance. You lower a chance not to get injured. So if you are diabetes or pre-diabetic, I would highly encourage you always wear socks and with a cover slippers or shoes. Do not wear shoes with no socks and just a Japanese slippers around, and you can either kick something, injure yourself. That is really a potential risk. So always wear shoes or cover shoes with socks, okay? So to examine your foot, the first thing you gotta do is remove your shoes, remove your socks. Then you should always check for any kind of sore, any kind of blister on the foot area, the toe area, the back. You have to check with that. Now, you may say, I can't see it because I'm too fat. I can't look down. Well, yes, some of these people might have that problem. You might ask some of your family to help you out, or you can use a mirror, extended mirror, to look for the exam. You also need to look and inspect the toenail, see whether any area has redness, swellness, and you have to look at any skin which is dry, cracked, colors has come out. And also you have to check swellness, redness, and also test for foot sensitivity. Very important. So 嗱，記住糖尿病病者咧係要好重要咧，你係應該去着一對鞋同埋着襪嘅，因為咧記住，如果你有襪同鞋咧，個 chance of 你去整傷隻腳咧係少好多。所以如果你係前期患病或者糖尿病咧，喺屋企你都應該着襪着鞋，又唔好着拖鞋周圍走。因為拖鞋如果係冇鞋冇襪咧，你一撞到咧傷咗之後咧，可能真係唔好嘅。咁呢個你要記住啦 ，OK？ 咁第二樣嘢咧，要 check 下隻腳有冇任何嘅割傷嘅損壞啊，或者係有少個瘡喺度啊、水泡啊呢啲咧，又要再睇喎。咁同埋咧，又要睇下個茶嘅腳趾甲裏邊有冇咩唔妥啊、紅腫啊，或者係有少隻裂咗啊，或者係咁樣趌咗出嚟咧，咁要處理呢啲嘅 ，OK？ 咁同埋個皮膚咧係咪好乾咧，或者好有 cracks 咧，即係有啲裂痕咧，呢啲又要嘅，因為如果唔係咧，你要搽翻啲 cream 咧去處理佢嘅。如果唔係咧，呢啲咧就會將來第時會爛咗佢嘅，即係你唔處理佢咪爛咯。咁仲有好重要要 check 下有紅腫啦，或者發紅啦。如果紅嘅地方咧，就好似即係會係發炎啦。咁同埋再睇下係咪有不同嘅敏感度啦。For example， 我話冇感覺嘅，咁你就要真係要好注重呢樣嘢，因為好多糖尿病真係用隻腳突㗎冇感覺嘅。So now we'll talk about how to examine earlier. Now we'll talk about how the potential complication occur. Now, as I mentioned, individuals with diabetes have a high risk of foot complication. So this is why you got to really look at your foot every day to detect any sign of issue of your foot, so you can treat right away to maintain a better health for your foot. Okay? 嗱，頭先我講過啦，糖尿病病者好重要咧，真係每日睇隻腳啦，因為你嘅腳咧係可能好多時咧係有 injury 你唔知嘅，咁如果你唔處理咗佢咧，你會係一個好大嘅complication，which is 因為壞咗之後咧，弊家伙啦就會係令到你咧係會即係一個好多即係腳嘅毛病出現啦。So now we talk about some of the signs and symptoms. Usually, if you have this foot complication, what would that be? And I would like you to look at it carefully. First of all, redness and swell on your foot or toe is very, very important to a first sign of problem. Redness meaning it is infection. Swellness meaning it's infection. And it's usually on your foot and toes. So you have both occur or even a redness occur. The next thing you know, gotta have some swellness occur. So when you have that, that's mean you have foot and toe infection already. So you gotta do something to treat it, okay? Secondly, the second sign and symptom you have to look at is the area touch is warm and it's sore, tender, it's sore. It is really, when you push it, wow, it's pain, okay? Now, pain is good sign because you should know that you still have some function there. If you have no pain, I know, sorry, you really have another set of problem coming in. Maybe your foot already have a lot of so-called nerve damage, so you can't even feel the pain anymore, okay? Then you have to look at open sore. So you have a sore that is open, a wound that is open, and it's not healed. That is another sign and symptom that you have to really watch. Now, if you have also fever and chill, that means that you have an infection around, then meaning that sore, whatever you have on your foot, could be causing you already starting an infection. So meaning that it's getting more and more serious. If your foot really becomes foul smelling, like a dead skin, a drainage, and a wound, and sore, that can become even more serious now. So all this symptom, you got to really take it seriously. So really at the end of the day, whenever you see the early symptom redness swell, you got to really maybe see a doctor already, start treating it, so you don't get yourself into a foul odor, drainage, wound, and sore, okay? So I hope that the first three symptoms, you won't lead you to all the other two, your chill, fever, foul odor, because when you get the foot become dark red and black, you might end up with a cut on your foot. Wow, that would be terrible. So this is something that you get able to spot, get treated, get the doctor to tell you, hey, I have a problem. So hopefully you are alert ahead of time. So this is something you have to do, okay? 嗱，各位同學，頭先講咗咧就係點解你要 check 啦。咁依咗咧講咧就係你睇啲乜嘢咧？嗱，第一你睇咧就要睇隻腳有冇紅腫，紅同腫咧就係一定有發炎噶，多數紅咗之後就會腫嘅。所以如果係咁講嘅話咧，你嘅腳同埋你嘅腳趾咧，如果紅定腫咧，即係話你開始有發炎噶啦。咁第二咧，你摸落去咧係暖嘅、warm 嘅，但係同埋仲有痛嘅。咁啊痛係好喎，因為痛咧你仲有感覺。如果你冇咗感覺咧，仲更加弊，即係話你嘅 nerve damage 幾犀利。第三，如果你啲腳嘅傷口咧係亦都係痛啦，同埋係有一個傷口係就又唔會囂好啦，即係唔會生得埋啦。咁呢個亦都係一個危險嘅東西出現㗎啦，即係話你係已經糖尿病去到咧係嗰啲傷口未必咁好，未必生得翻埋。咁你就一定要處理，因為你唔處理咧，呢個一定係壞落去嘅時候咧，你就越整越禍嘅。咁第四個東西咧就係你會有發燒啦、發冷啦，即係話你已經開始發炎到身體已經開始有發燒發冷啦。最後咧最差開始就係你會有好臭味嘅傷口，同埋會 drain 好多嘢出嚟嘅。咁嗰陣時咧就可能咧你個傷口咧已經進入一個好差嘅地步。咁其實咧，如果你係有第一喺度第一、第二、第三咧有呢個咧，就快啲去睇醫生去醫啦。變咗你希望你唔會去咗醫啲咁嘅情況，有發燒啦、發冷啦，同埋有異味嘅傷口咧，咁就認真唔正仔。OK。Other sign and symptom you are look at is you also numbness, tight tingling in the feet, which is also very common to diabetes. And then you are also loss of sensation, the ability to feel pressure, heat, cold in the feet, for example, or hot, And then a lot of people also describe them a burning, a sharp pain in the feet and toe, which is common. And also muscle weakness in the feet or the leg, okay? So these are, again, another set of signs and symptoms to show you, wow, your foot is really having some issue starting because of diabetes. 嗱，各位朋友， 好重要咧。好多時你糖尿病嘅人咧，就好多有腳嘅麻痹啦，同埋刺痛啦。嗱，呢啲咧就唔係淨係糖尿病嘅麻痹同刺痛咧，同埋肝咧，係好多時咧係喺前期患病嘅人都要開始有嘅。所以呢個咧係要開始去注意嘅。OK， 咁仲有咧就冇咗個感覺腳嘅感覺，又凍啊熱啊都冇嘅，失咗個感覺。嗱，所以變咗嚟講咧，千祈唔好係糖尿患病者，我揾隻腳去試下啲水夠唔夠熱，因為好多人就係咁樣燙傷咗都唔知 ，OK， 因為佢冇個感覺啊嘛 ，OK， 所以記住就唔可以就揾隻腳去試下啲水熱唔熱，你去可以試，但係就唔係你糖尿，我唔知你個腳係有冇呢個感覺啊？咁但係如果你冇咗呢個感覺嘅時候咧，咁即係話你糖尿病都係好大問題喺度啦已經。咁仲有咧個隻腳咧就會好刺痛，會俾人燒咁樣啦，有 sharp pain 啦，就喺腳嘅腳底啊，同埋個腳腳趾公嗰窄腳趾裏邊咧，成日都有呢個 feeling 咧，呢個都係常見嘅。咁但係仲有一個咧係個肌肉係會覺得好冇晒力，同埋咧腳冇力就肌肉冇力，呢個亦都係一個 sign symptom 咧，係知道呢個即係你嘅腳嘅問題已經出現咗啦喺糖尿病裏邊。And also another sign to look at is also your skin become pale, cool on the feet and toe. And actually, very important, you're on top of the, like this is the foot, for example. You should able to press down and feel the pulse. Okay, this is your foot. And you see the toe, you should press it here. You can see the pulse. Okay, you feel the pulse. Okay, now you don't feel the pulse and feel very weak. That's mean you are really having a problem coming in, that your leg is lack of, nerve circulation become very poor, and that's usually the case. Another one is hair loss of the entire foot and leg. Now, this is also can be very much potentially for not only diabetes, but also for people who are pre-diabetic. So imagine if you have loss of hair and foot, if you are pre-diabetic, you better start every day really look at your foot, because you are now already moving in the stage of you require very much foot care, foot management. And also the wound, look at sign, it doesn't heal. It continues to be the same shape and get worse and worse. And then the sore on the foot, that's another sign you are stepping into that diabetes issue of the foot, okay? The more important is, especially on your toe area, on the back, bottom of the skin, have redness, swell around the sore. That is really also something you have to look at. Plus, you see this area? You have started getting a sore, it become warm, tenderness around the sore. That's another one that you got to look at. If you have your foot become turned black, and you have some foul smell, and you have a drainage coming out, that is, again, very bad sign. So what we gave you just now, all the sign and symptom of the sign you look for. So I know it shows you a lot, but few point to remember is one, anything with redness and swell, you gotta be careful. Two, warm to touch and it's painful, that has to be careful. Foul and drainage in the sore is really getting bad. And you have an open wound, it doesn't heal, that is really, you have to look for. So this four thing is summary that even if you have a lot of signs, dry foot and all that, but this is something you got to remember. Matter of fact, you can take a picture if you want to. 嗱，各位堂友，我哋講咗好多不同嘅概念啦。check 咩啦？重要點記住，如果係周圍係發紅同埋腫脹咧， 呢個就問題好大啦。第二係摸落去嘅時候咧係暖嘅，同埋咧亦都痛嘅，咁呢個亦都係有問題喎。同埋最弊要有啲惡臭嘅味出緊現，又會 drain 咧，呢個係好大問題，因為呢個就開始有 gangrene 嘅 issue 啦。同埋咧，所有腳任何嘅地方有瘡會好，傷口唔好，呢個有問題。所以今日講咁多嘢咧，最緊要就係記住呢幾樣嘢，呢啲係全部嚴重嘢嚟㗎，因為如果唔係咧，你就唔會好嘅。Okay, so how do you prevent, give you a proper management of this, prevent you get into that stage of injury of foot? Very important, always wear proper footwear. Because you have proper footwear, your foot will be always prevent kind of any injury. So if you have proper footwear, you don't get rub your foot under a hot shoe, you don't get sore, you have socks protect, and also socks can make sure prevent any kind of injury. So all that, proper footwear with proper socks with a cushion, those are important. Secondly, you have to always regular exercise, improve the circulation of foot. In other words, if you walk, run, don't have to actually run, just quick walking, it's already good because you are providing a foot circulation. Now, certainly a lot of people say, can I massage my foot? Absolutely, you can massage your foot. That would be another very good thing to do. If you every day soak your foot with some salt, is also very good because you relax the foot, prevent, get your foot become moist, and put ointment on your foot. That will be also good. Plus, very important, you have to check your blood sugar. Healthy food, blood sugar, you can able to make sure that your blood sugar is always below 6.4 daily. So you will be very good. So this is going to help you prevent a lot of your potential problem. 嗱，各位同學，記住，就着適合嘅鞋咧係好緊要嘅，因為如果着啱嘅鞋同埋好嘅襪咧，你有好多 cushion 唔會整傷隻腳，咁又會起腳嘅瘡啦，係咪？第二樣嘢你要繼續去運動，定期運動咧就幫助咗你咧隻腳好多 circulation， 就唔會令到咧即係有 circulation 隻腳就會好噶啦，就變咗即係有啲 circulation， 即係就算你啲嘢有少唔妥咧。就因為有 circulation 咧，都會就生得翻埋嘅。如果冇咧，咪係一路自己越差，係咪？咁仲有咧，就要需要咧繼續去令你嘅糖降低，每日個 average blood sugar 要低過6.4 ，OK？ 或者係120以下，或者115以下啦 ，OK？And plus, what else you gotta do? You have to continue check up with a healthcare provider like a doctor to make sure to look at the foot problem. If you have done the 4 signs, remember, you have a red, warm, pain to touch, and also fouls, and then open wound don't heal, you better go check the doctors, okay? And then we will provide you tips to basically daily to check not only your foot, but also maybe massage your foot, to soak your foot into a hot tub, to soak your foot inside, to basically maybe 10 to 15 minutes warm water now, not hot water, warm water. You put some salt in there. So after that, you dry your foot and you massage your foot. That will be a very, very good practice daily, okay, to help you to get good foot practice. Plus, at the end of the day, you got to drink Lowsutea to lower your blood sugar, to get your blood sugar lower than 6.4, okay? So the next question is, really, can Lowsutea really help you? Absolutely it is, because Lowsutea does will help you lower the blood sugar, cholesterol, and blood pressure. And then also, 其實咧，仲有一樣嘢好重要咧。如果你有咩事咧，你好快脆要去睇醫生，因為如果你唔睇醫生咧，你個問題咧就好快出現。你見到嗰4樣嘢啊，譬如好似有隻腳紅腫咗啦，有臭味啦、痛啦，你快啲睇醫生去醫啊！如果唔係咧，佢越整越差，就去到嗰啲黑色嘅， 隻腳變咁黑色啊，又夠臭啊，咁你可能要割咗個腳，呢個隻仔。咁仲有咧就係點能夠令到你腳係可以係好舒服咧？如果你係一個糖尿患病者，你係需要咧每日咧浸一浸嘅10至15分鐘，揾啲暖水浸下隻腳，撒啲鹽喺裏邊啊，同埋去浸下隻腳。咁而浸完之後咧，仲要揾啲油咧去 smooth out 隻腳。咁呢個咧係會一個十分好嘅 practice 嘅 daily life 嘅 practice。咁令到你咧更加容易咧係令到隻腳咧係又滑啦，又唔會話有即係傷瘡有瘡啦，因為你即係日日都睇住佢，唔會俾佢有瘡噶嘛，係咪？咁繼續咧就做完呢啲嘢之後咧，繼續飲去糖茶。咁點解去糖茶咁好啦？就係個女糖，我嚟咧再幫我降低血糖啦，降低血糖能夠令到跌到6.4以下啦。仲有膽固醇咧，去由呢個高位3咧，可能到2以下咯。咁或者咧就你血壓會同埋同你排毒。咁呢個係一個好重要嘅元素啊，繼續去做呢樣嘢。So what Lowsutea have done to help you is lower your blood sugar, blood pressure, blood cholesterol. So continue helping you have to drink Lowsutea to help you to change your lifestyle. Got to do exercise, weight control, and also monitor your blood sugar go down to below 6.4. And that will be a very good practice. 各位堂友，我哋做即係睇完隻腳之後，我教你哋已經每日去浸下隻腳啦，10至15分鐘浸腳啦，去 examine 隻腳啦 ，make sure 佢哋冇 open wound 啊，擺啲油啦去 massage 隻腳啦，仲有咧係要隻腳要乾啦，同埋着襪啦，着鞋啦，唔會整腳傷啦，咁就係飲去糖茶啦。咁呢啲嘢咧，全部咧係幫助你解決咗。你有個potential 嘅風險咧，係將隻腳變咗壞嘅。咁當然啦，如果你解決咗降低你血壓、降低血糖、膽固醇同血壓咧，其實你身體都會一個10分已經係好健康嘅。Okay? So in conclusion, the daily food exam is so important because of the fact that it's part of a diabetic management. And the reason why I need to help you to do this now, because you want to establish what? A habit. If you have the habit, you will do it every day. And when you get older, you're still going to do that. So help you at least prevent serious complications. And that's what we want to do. And proper food care can help individuals maintain a better quality of life. Because you know what? Because of an injury, wow, then you have to go to the hospital because you got a foot cut off. You cannot mobilize. Wow, that would be terrible. Because just like my Japanese lady patient, she's such a nice lady, but she has no foot. Okay, she got a wire. And so you have to basically, once you have issue, you got to see the doctor to get your foot being treated. Don't wait because, little infection can get worse and worse and worse. 所以今日嘅節目咧，好重要俾大家了解，我哋要自己管理呢個腳嘅問題。如果你前期患病或者依家糖尿患病，唔緊要，你開始 establish 呢個習慣。當你有呢個習慣咧，你就可能夠將你呢個問題咧防禦你個嚴重嘅併發症，適當去保護你隻腳，幫助你個健康生活嘅溫習一個糖尿病嘅生活嘅習慣。如果你前期患病，你都要咁做，因為咧你唔知幾時你要轉翻去糖尿病嘅，同埋你有咗啲習慣咧，繼續 practice 咧，你會都 examine 腳啦，會按摩隻腳啦，或者擺啲油喺隻腳啦，咁你腳亦都唔會變壞喎，因為你已經 take care 隻腳take care 佢嘛，咁 how nice，right？ 咁所以今日咧，我哋講咗呢樣嘢，咁你依家有個概念咧，就開始嚟做啦。日日做就幫助你咧 prevent 你隻腳會轉壞。咁然後之後咧，如果有咩問題咧，記住即刻揾醫生去睇，同埋記住係飲去糖茶咧，降低你血糖。Okay? So today, hope that you guys have a very good idea, concept, understand what your issues that you might face if you are diabetic, why your foot become numb because nerve damage. why you have to massage your foot, because poor circulation. If you're injured, it's going to slow heal. You got to see a doctor. You got I show you 4 signs: red, warm, foul smelling. That's going to not good. So you got to quickly take care. So if you have any question, feel free to write to me, Andy@wafong.com, and I would love to call, answer you. You have WhatsApp, you call, ask me this number on WhatsApp, 301-5644, or write to me, Andy@wafong.com. And I'd love to answer a question. I hope that will help you to, get you first the concept of what is diabetic foot care. It is a very serious serious issue that you cannot ignore, okay? And I saw too many patients of mine end up in the ICU because the foot had been cut off and, all kind of sickness. So it's not worth it. So are there any questions for everybody? Okay, if there are no questions, I really appreciate everybody spend the time listen to my lecture. I hope that you guys gonna have a good weekend. So remember now, every day, even you are pre-diabetic or diabetes, doesn't matter, start examining your feet. And start examining your feet. On top of that, massage your foot. Also put cream on your foot, ointment. Make sure the foot becomes very moist. Because even pre-diabetic, I have a lot of patients pre-diabetic. They came back and said, hey, my foot become very dry. It's not getting cracked. And it's not getting cracked. It's not, doesn't heal too well. So I said, well, you can put foot, you're going to put cream. And they notice things are really much more improved. So little thing, every day you do and work, things will improve. So that is what we're trying to do, okay? So thank you again for attending our webinar. I appreciate all your help to listen. And if you have any question, write to us. Looking forward to see you soon. I'll see you next week. Bye-bye.